Elizabeth Linden for the National Library of Patient Rights and Advocacy. My guest today, Bennett Kanarek. Robin was a registered nurse working with patients suffering from chronic medical conditions when her 10-year-old son, David, was diagnosed with leukemia. As David endured grueling treatments, Robin realized how often medical professionals overlook critical psychological, emotional, and spiritual support for people with life-threatening illnesses. She responded by writing Living Well with a Serious Illness, a culmination of decades of Robin's work to advance the field of palliative care. In addition to her roles as mother, nurse, and palliative care advocate, Robin serves as president of the Kanarek Family Foundation. The foundation's mission is to improve the quality of life for those afflicted with life-threatening conditions through promoting, integrating, and educating the medical industry and the public about palliative and supportive care in all areas of healthcare. Welcome, Robin, and thanks for joining us.
Thank you so much, Elizabeth, for having me. I'm really grateful that you reached out. As you mentioned, the mission of our foundation is to improve the quality of life for those with a serious illness. A serious illness includes those with cancer, heart failure, kidney and lung disease, Alzheimer's, Parkinson's disease, severe brain injury, and many other conditions. Education is imperative for medical professionals and the consumer. Not everyone understands the full scope of palliative care and how it can improve quality of life at any stage in a serious illness and at any age. Palliative care provides support, symptom and pain management, and it is patient-centered, which means it includes medical, physical, emotional, psychological, and spiritual aspects of care. It addresses the whole patient and can be provided at any stage of a serious illness. If a patient and their family or caregiver is supported, then there's less stress for the patient and their family, and they are well informed. And research has demonstrated that those who integrate palliative care into their medical care early in the diagnosis of a serious illness live longer and are less anxious about their condition because they feel supported.
Could you provide a brief overview of palliative care as it is provided right now in the United States?
Sure. Palliative care is gaining a strong momentum in healthcare right now. It became a medical specialty in 2006, and although it's been around since the 70s with Dame Cicely Saunders, who founded the hospice movement. Most hospitals with over 50 beds in the United States offer some form of it, but some are better than others. Larger urban hospitals will usually offer a full spectrum of palliative services, which includes an interdisciplinary approach, meaning doctors, nurses, nurse practitioners, social workers, psychologists, and chaplains, all working together to address the needs of a patient. Each patient is different, and the team works together to address what is medically relevant, as well as deciphering what is important to the patient and their family. For those patients who live in a rural setting, palliative care may not be as prevalent, but COVID has changed that. It accelerated the use of telemedicine. Many people use Zoom. Providers at large medical centers can connect with a colleague in a rural setting and will assist, evaluate, and care for patients via the use of the computer, cell phone, or through a telephone call. Teleconferencing has totally changed the face of palliative care environment for those who wouldn't necessarily have access to palliative care.
Oh, that's very interesting. That's very beneficial that we have Zoom. Yeah, that's great. And as a firsthand observer yourself of palliative care, do you feel that the healthcare system is missing something in the way it approaches palliative care? Or do you feel that palliative care right now is working?
Good question, Elizabeth. While palliative care is becoming more integrated into hospitals and becoming more mainstream, there is still much confusion over what it is and how it is differentiated from hospice care. Palliative care is not hospice care, and I want to underline that.
Mhm.
Hospice is end-of-life care. It requires a doctor's order in order to receive it, and the patient and their family is fully aware that there is no cure for their condition, and they usually have less than 6 months to live in order to receive it. Palliative care, on the other hand, can be provided at any stage of a serious illness, meaning it can be provided at the time of diagnosis and at any age, from birth to the very elderly, alongside with curative treatment. People with a serious illness can live for many years with their condition if they are fully supported medically, physically, psychologically, and spiritually. Unfortunately, palliative care is not fully utilized due to much misunderstanding. We need to change that, Elizabeth. That is why I wrote the book, Living Well with a Serious Illness. It is a guide on how to live with a serious illness for mind, body, and spirit. Palliative care was not available to us when my son was so sick. He was diagnosed in 1995 and died in 2000. Palliative care was not a full specialty until 2006, 6 years after his death. It was after his passing and through extensive grief counseling that I spent a considerable amount of time, trying to understand how David's care could have been improved upon. Palliative care would have been so beneficial to us as a family and to David. No one addressed what was emotionally troubling David when he was in strict isolation after his transplant. Social workers were not fully utilized in his care. A chaplain trained in palliative care was not integrated to help him cope with his spiritual and philosophical needs. I learned about all the benefits of palliative care after David's death. Although I couldn't help him at this point, I knew deep down inside that he would have wanted me to help others. I was published in many medical and nursing journals to share our personal experience with colleagues prior to my decision to write the book. Then in 2019, I decided I had to write a book for the consumer because after doing a lot of homework on this, I really realized that there wasn't one book written solely on palliative care for non-healthcare providers. I needed to get the word out on how it improves one's quality of life. If the consumer is educated on its benefits, they will ask to receive it. Most doctors are uncomfortable discussing this topic with their patients due to misunderstandings. But if the patient brings it up to them, the doctor will listen and will usually recommend it. Liz, we have a lot of work to do in palliative care. We need to get much more reimbursement for institutions that provide it to their patients. Much of palliative care is still financed by philanthropic initiatives, such as Cambia Health Solutions, the John Hartford Foundation, and the Robert Wood Johnson Foundation. This is not necessarily the most cost-effective way to deal with the issue at hand. Government and health insurance companies need to step up to help those at their most vulnerable time in their lives. Our family foundation, the Kanarek Family Foundation, established a palliative care educational center at the School of Nursing that I graduated from in 2017. The university is called Fairfield University, and they're in Fairfield, Connecticut. We also contributed to an advanced communication simulation education program for pediatric nurses at Memorial Sloan Kettering Cancer Center in New York City. And most recently, we provided a grant to establish a pediatric spiritual educational curriculum for healthcare providers at George Washington Institute for Spirituality and Health in Washington, D.C. Led by Dr. Christina Pukalski and Dr. Betty Farrell, these world-renowned leaders in palliative care helped in developing the pediatric curriculum for health providers to learn about an area of care that has never been addressed before: spirituality in the eyes of children who are facing serious illness.
Oh, wow. And I just want to add an additional question. Is it only available in the states that you mentioned, or, like providers in other states, are they,
Oh, no,
aware of what you're
palliative
doing?
care is available
Oh,
nationwide.
okay.
It's just
Right.
that urban areas, big cities, because they have larger numbers, will sometimes have bigger programs. But
Okay.
telemedicine has really changed that.
Okay, great. Okay, that's really good to hear. And finally, why is palliative care so important today as more folks live longer and would rather remain at home at the end of their lives rather than spend those precious days and weeks in the hospital?
Elizabeth, you answered that question. There is a growing aging population. People are living longer, but sometimes with many chronic conditions, such as health, kidney, lung diseases, and diabetes. And this can affect their quality of life. Soon, baby boomers, which includes me, will require more care and support. And it is so important to share your wishes and advance directives with your family and healthcare providers. You need to make very important decisions on how you want to live if you should be diagnosed with a serious illness, and this should be done while you're still healthy. These are conversations we have to have in order to get the care that you want. Both my parents have since died. My mother had a chronic neurological disorder and lived for 10 years after her diagnosis at the age of 84. My father made a concerted effort to incorporate palliative care to address my mother's many physical needs. She required physical, speech, and occupational therapies and round-the-clock care. I did not want her to die in a hospital. Our family worked together to keep her at home to die peacefully. We were all together when she passed. My father was so overwhelmed with how peaceful the whole process was that he explicitly told me that he wanted his end of life to be the same as my mother's. He developed several severe health conditions once he turned 95, and he died recently at the age of 101. He died at home with his favorite music playing, and my brothers and I were at his bedside. My father died as he wanted, at home, comfortable, and well cared for until the end. And it brings me so much solace to know that I helped him die as he wished. Elizabeth, we are all going to die, but we do have a choice over how to be cared for in the event of the diagnosis of a serious illness. Palliative care helps you take charge over your health care wishes and is based on your needs, not one's prognosis. You will be supported for your mind, body, and spirit. Thank you so much, Elizabeth, for having me on your show.
Yeah, and thank you for being with us today. You certainly helped us better understand the importance of the important part of the life cycle, and we thank you so much. I'm Elizabeth Linden for the National Library of Patients' Rights and Advocacy, and I hope you have a great day, and thank you so much for helping us better understand palliative care, and have a great day.
My pleasure.